Okay, good morning. Let's have a class. We will finish this slides, talk about bacterial disease. First thing, same as we did for the exam 1, for every lecture section, we are going to do a brief review what we talked in last class. So we want to go over to here. So remember, in the United States, we have a very good immune system, or so we say immune scheduling system for the kids. Once they born, after 2 months, you need to see your physician and you get some of the vaccine. One of that is DTaP. That's we already talked about. It's a vaccine has been covered by 3 pathogens. So what we have, what is the D? The Clostridium diphtheria. Clostridium diphtheria. And we said this is gram-positive, large-shaped club arrangement. And this cause the problem is exotoxin. And they comes out with 2 very typical symptoms is ball neck. And also what we have the other one, it is cedal membrane in the tonsil area. And we talked about this, we'll have the terrorite blood agar to do the isolation, and also we have to transfer them into the reference lab. And we talk about this toxin is coming from a beta-phage through lysogen journey conversion. And we also say the bacteria is localized on the tonsil area and the toxin is very invasive. So this is what we have for the first one. Here we haven't talked about that, the Clostridium tetanus, we'll talk about on Thursday. Bacterial pertussis, this we talk about is whooping cough. And we said that there is a one thing for these 2 bacteria are the same, both are AB toxin. So we have a toxin domain and a transmembrane domain. And this very special, we have a dacron swab to do the nasopharyngeal sampling. And following that, we need using PCR test to do a quick one. I forgot to mention one thing. For bacterial pertussis, we can using Reagan lower transport media to transfer them, and also go to the reference lab to do the confirmation. Okay, so these are the 2 things we talked about. Then we talk about the meningitis. The meningitis, we mentioned about the Haemophilus influenza. It's the #1 childhood disease, and the Bacillus gram-negative. So gram-negative Bacillus. And we also talked about the other one is Neisseria meningitis. And this is typically for undergraduate students because the typical symptom is tough neck. And then we also talk about the age group. This is Streptococcus agalactia. We're going to talk real quick. This is 2 months to 5 years Haemophilus influenza. And 5-year to 40-year, this is Neisseria meningitis. And the older people is Streptococcus pneumonia. And this we're going to talk real quick. Okay, so that's what we have talked about that. And of course, we learned that Haemophilus influenza is fastidious bacteria. So you need XV factors to grow. And the X factor is hemine, and V factor is FAD, NAD, sorry. And then it's also have a set-like phenomenon on the blood agar. So all these things, it should be on your mind, and you hence can remember some of the key characteristics, and will be very good for you to do the review, okay? And also don't forget about to read the after-class reading notes, especially next week. Because Tuesday we had a lab midterm exam, we don't have the lecture. Thursday is fall break. So you can use in the time to read the after-class reading material, since we're going to talk about all the pathogens. There is one thing I also going to remind you that, please do not talk there, okay, because other people want to talk. Just to remind you that exam 1 relatively is straightforward, so lots of you did very well. Start from exam 2, we have lots of pathogen comes out. You have to be reviewed periodically, especially reading the after-class reading and have the flashcard ready. Although we same has practice exam questions, but all of a sudden, you have like 15 or 20 bacteria names suddenly showed up. With some case study, it is hard to review in only 1 or 2 days. So you have to really to read and do a brief review by yourself before the exam. And also the exam 2 goes really quick. It's not that long time. So be prepared for that. And do not think about it's the same. Of course, if you reviewed, it's going to be easy. But if it doesn't look, or you study overnight or like 1 or 2 days before the exam, it will make it very hard to remember all those characteristics and all those pathogens. Especially we have some case studies will help you to figure it out. Okay, so that's kind of thing I want to remind you. Today we want to start from here, blood agar. This is an important one we talk about. So on the blood agar, we mentioned about blood agar is the enrichment media. Bacteria can grow dramatically to the 10 to the power of 9 cells per ml. But more importantly, this is a differentiated medium. Why it is important in the clinical area? Because we have, I don't have the green one, I'll just use the yellow one. We could have dark green colony. This is beta hemolytic. Alpha hemolytic. And you also could have a colony there, which is transparent zone. You have a transparent zone surrounding the colony. What that means, which means the blood agar, you took it out, facing the light, you see the back is completely transparent. You can see the other side of the agar. That is called beta hemolytic. Completely hemolyzing of the blood cell. Or you have some colony and nothing happens. So we write Na, that's called gamma hemolytic. Now today we will talk about the streptococcus. They will be separated onto alpha and beta hemolytic. So we started from here. is the introduction of the blood agar as an enrichment media and a differentiated media, and especially this slide is important to get you started what we're going to talk. So we first will talk about Streptococcus. Streptococcus, we talk about briefly. It is gram-positive. We already said it's a coccus, so it's a coccus. And most of the time, it is chain arrangement. But this chain could be long. It also could be very short, only 2. But it's a chain arrangement. We wanted to introduce you to use the first one we call alpha hemolytic strip. And there are 2 different things we want to talk. Is Streptococcus pneumonia and viridine strep. We will be spending some time talking about this stuff. Okay, that's called alpha hemolytic, which means these Streptococcus use streak plating onto the blood agar. They are all dark green colony, incomplete hemolysis of the blood cell. There is one thing I want to let you know. Streptococcus and Staphylococcus, both acronym is S. But, for example, S dot. But this is the first time you learn. We want you to be not confusing. So Streptococcus, I use STREP, but it is not a scientific name. It's just I write to let you understanding. Okay, Staphylococcus, I sometimes write STAPH, just to let you understand. But scientifically, it's all right as S dot, because I don't want you to confusing. So let's talk about this. Streptococcus pneumonia. Okay, species name is pneumonia. So, this is a pathogen cause 80% cap in the US. What does this mean? This is a major pathogen cause community acquired pneumonia. C stands for community, A stands for acquired, P is pneumonia. It's a big risk in the United States in the public health in area. What is the symptoms of that? Think about when you get severe flu or you get pneumonia before. It has fever, chest pain, and cough. Sometimes the X-ray has cloudy area in the lung area. Sometimes, not all the time. Sometimes you find it. Okay, that is a typical symptoms. But luckily, we all had a vaccine for that. If you go back to look at here, is somehow the pneumococcal PCV vaccine, it is not required. Usually the family doctor will not give you that shots unless you request it. The PCV vaccine is actually working sometimes. Although you didn't do all the time. Just want to let you know. So why we can do that? This bacteria we talked about, it is gram-positive coccale and diprococcale looks like this. But why we can make a vaccine? They are heavy capsule. And this heavy capsule could isolate it and purify it and make a vaccine. Remember, we talked about this one before. In order to do the observation, lots of the time what we have to do, we want to show the diprococcale is more obviously to do the observation. So we are doing the dark, we are using to staining the background to become dark. So that is called a negative stain. Is that right? Use nigrosin and Indian ink. Then the capsule could be showing up, and also the diprococcale is more obviously to showing to you. This is the one we also call it a lancet shape. It's a little bit curved, not really straight. Okay, so that's why we can make a vaccine from it. Regarding this pathogen, we talk about this is pneumonia. But you always remember this pneumonia is for adult. Now for the kids, what will happen? For the kids, 2 to 5 years old, they could have pneumonia, but more often they will have is otitis. So what the otitis will happen is you feel about fuzzy, you feel about raining, you feel about ear pain. It's an inflammation of the ear, you can understand about that. Another thing is that because Streptococcus pneumonia have the heavy capsule, so this pathogen is very invasive. And it often will happen, could be into your bloodstream. So here is something I want to let you know. Your bloodstream should be sterilized, which means no bacteria. If you find a bloodstream isolated, or blood sample, you showed up the bacteria, any bacteria which is abnormal, that is called bacteria, semia, or we call septicemia. The difference between that is bacteriemia is bacteria we do colonization, which means they grow there, and the septicemia they do multiplication, which means not only the colonization, they also grow there, which means it's very invasive. Now, how about the older people? If people more than 40 years old, these older people, Streptococcus pneumonia, not cause pneumonia. Remember, we just reviewed it. It will cause meningitis. So this pathogen, although it's called a pneumonia, but for the different age group, they show the different symptoms. But we usually say this is a big one. In the United States, it's 80% cap. This tells you something. Remember, we talk about alpha hemolytic. You have Streptococcus pneumonia, you have the Viridam streptococcus, which means you have other streptococcus. Now what this means, Viridam streptococcus, usually it is in your oral cavity. So what that tells us, usually in the teeth. Viridam streptococcus basically is, we can say it's a normal to mild pathogenic bacteria in the oral cavity in the teeth. But it could cause problem, which is very often you will hear, is 70-year-old grandma go to see a dentist and took out of the wisdom teeth or do some of the oral surgery. And a couple of days later, she got a severe contamination or infections. Because Viridam streptococcus could cause endocarditis. This is the inflammation of heart valve. But basically say it is normal or to the milder symptoms, but could cause endocarditis, okay, which is a severe inflammation of the heart valves. It could cause people to die if the post-oral surgery or dental surgery failed a standard sanitation procedures. So just want to let you know. Now, what are the examples of the Viridium streptococcus? Streptococcus mutans, bovis, all those is an example of a Viridium streptococcus. So, let's say you have a patient who have the cough. So you use a blood agar, you do a strict plating. You will see both of these two colonies, Streptococcus pneumoniae and Viridium streptococcus, they are all dark colony. So you cannot differentiate that. So how are we going to do? We are using something very magic. Looks like the slides. We call it a P-disc. So what happened is, we do another blood agar. Oh, the blood agar, we put those discs. We write a P in the middle. What the P means? It containing an antibiotic is called opticant. It's a very special antibiotic. Why? Because Streptococcus pneumoniae is very sensitive to that. By the way, we don't usually say sensitive, we say susceptible. Later on we'll mention. It's very sensitive and susceptible to opticant. So opticant can kill that. You will see this is transparent zone. And then on the other side, if we are growing or streak Viridium streptococcus, then nothing will happen. It could grow very well. So, Viridium strep is resistant. So, in the clinical area, we're using opticant as a component of P-disc. We can do a very easy determination which one is which, if we end up with only those two categories of the streptococcus. If you have others, then it's maybe more complicated. So, just want to let you know, a very easy one to do is using a P-disc to differentiate Streptococcus pneumoniae and Viridium streptococcus. The results, example here, they're using Streptococcus mitis. That's another group we call it a Viridium streptococcus. Okay? This couple of slides we mentioned, the slides tells you about what happens for Streptococcus pneumoniae. I just mentioned the treatment, some diagnose the symptoms and treatment. Obviously we're using antibiotics, but the immunization is important. And this is a streptococcal disease we already mentioned. Could cause bacterial, meningitis, otitis, and the prevention, treatment, control using antibiotic therapy, and also we have a vaccine for that. So that's the Streptococcus pneumoniae, and also the Viridium streptococcus. Next one. This is the one we talked about a bit before. Here we want to briefly mention. We see these all the time in our real life. It's called Klebsiella pneumonia. So this pathogen is really tricky. Although this is called pneumonia, but indifferent compared to Streptococcus pneumoniae, this is 80% cap. which means 80% of community-acquired pneumonia in the United States is caused by Streptococcus pneumonia. Klebsiella pneumonia, it is only responsible for less than 2% of the pneumonia in the United States. But what it really causes a problem is infant diarrhea and urinary tract infection. Urinary tract infection, which means dysuria. You have a typical symptoms is difficult to pee. We don't going to talk in much detail in the lecture. We'll have one lab section talk about isolation, identification, the bacteria from the urine sample. We're going to do this in the lab. It's a pretty fun lab. We will talk about that later. Klebsiella pneumonia is pneumonia causes infant diarrhea and urinary tract infection. So a little bit special. This bacteria have a more heavy capsule. So what it looks like, the colony is mucoid. What it means, cheese-like. And you look at how heavy it is on the slides. Right side is blood agar. How sticky it is that looks like cheese. Very sticky. Left side is McConkey agar. It also can grow. The reason is, this is gram-negative. Single logs. Now I have a question. When you see on the McConkey agar, if it grow looks like that, what this tells you? First thing this tells you it's gram-negative bacteria because McConkey agar has crystal violet. So gram-positive bacteria will be killed, ideally. So this is gram-negative bacteria. Second, what's the color? It's pink. So why? Because lactose fermentation positive. So this is we also call lactose fermentation positive gram-negative logs. And the colony looks very special. Now, what are the typical symptoms for this guy? If Klebsiella pneumonia causes pneumonia, the sputum sample looks like currant jelly. This is the one not in the United States. Usually in the European country you have a currant jelly. What it looks like is more sticky than grape jelly. I know you know grape jelly. In the morning you have a breakfast, have a sandwich, put a grape there, grape jelly there, they combine, put the ham. That's very sticky. That's heavy mucoid. Could cause your sputum sample look currant jelly. But it's a very typical symptoms. But very surprisingly, this is only responsible for 2% of the pneumonia in the United States. And the Klebsiella pneumonia is everywhere. We get a sample from the chicken, from the rabbits, from the fresh produce. If we streak plating onto the blood agar, it all looks like that. It looks very heavy capsule. And the cheese milk looks like. Okay? So that's briefly introduce you about Klebsiella pneumonia. Streptococcus disease, this is Streptococcus pyogenes. So we want to talk about this. So we remove this off. Okay. We talk about the blood agar. It's a differentiated medium. We have alpha hemolytic. We talk about the Streptococcus pneumonia and the Bacterial Streptococcus. So, obviously, there is another one we haven't talked. Beta hemolytic Streptococcus. What are those two? Streptococcus pyogenes and Streptococcus agalactiae. Now, before we talk about these characteristics, we want to introduce you one concept. Look at the slides. That's the reason I don't like these slides. Streptococcus pyogenes. The first sentence doesn't mean anything. One of the most important passages we already know. Then all of a sudden showed up group A beta hemolytic streptococcus. What this means? Then they write bracket GAS, group A streptococcus. When you look at the textbook, there is 100 microbiology textbook there. Lots of them all of a sudden showed you GAS and GBS. They think you're smart, you know, but I don't think lots of people know. What is GAS? This is have a story behind it. Okay, what is GAS? Said very simple. Group A streptococcus. But what this means? This is the one coming from a great American clinical microbiologist, Rebecca Lansfield. Very great woman scientist. Back in 1920s, she did a great work. She isolated various, or we say multiple, streptococcus. Then infected or inoculated onto rabbits. Get the blood sample and the blood serum, which is have anti-serum. We call it rich in antibody. And then this go back to reacting with antibody-antigen reaction. And we'll see the precipitation. And based on the different grouping of the precipitation, he using serological grouping methods to group different streptococcus into his grouping system. This comes out with an important three major group. Group A, Streptococcus pyogenes. Group B, Streptococcus agalactiae. And group D, Enterococcus facilis. Now, why they can grouping? The story is you need to go back to see what we talked. The fluid mosaic model. Of course, this is cell wall, okay? All these streptococcus has an important M protein. This M protein could cause precipitation with antibody. And then they can be doing serological typing. How about this guy? Lots of people will have this question said. Why Streptococcus pneumonia is a so important pathogen, Streptococcus, they does not have any Rebecca Lansfield group. Because this guy, there is no M protein in the cell wall system. So, Streptococcus pneumonia does not belong in any group. We just say group Ni. Now, I gave you here is just some of the important examples. Of course, there is a lot of the other things, other examples. Not only those three, but those three are most important in the clinical area. Okay? So we want to talk about these. Let's talk about this guy first. Why I want to talk about this guy first? Because it causes strep throat. And I told people the joke. I said before the COVID-19, people doesn't come to AEM 341 lab It's very typical in the October and November. You will send me email has strep throat. And this is a pathogen will cause strep throat called group A Streptococcus pyogenes. So we want to talk about that. Streptococcus pyogenes. Since it is a streptococcus, so we already talked about. It is gram-positive coccell chain shape. We don't gonna repeat that. This genome name is important. What is the PYO? That means pus. What is pus? It's dead white blood cell. What is genes? Genetic. This pathogen is very typical for 5 to 15-year-old kids. Or we say it's adolescent, a little bit older. It's usually accompanied with strawberry tongue. This pathogen, obviously, is a typical symptom we already mentioned about here, is strep throat. Now, strep throat, you can see the tonsil area, how heavy it is. It's a heavy swelling with those dead white blood cells, and obviously you see the inflammation there. Or look at those white areas. But I tell you one thing, once you go to strep throat, it's a very severe symptoms. Because this pathogen is very invasive. What happened? Usually at the first stage is in the arm. You will see is a red little itching like a target area there. Okay, this is called impetigo. It's a surface contamination. This is first stage called impetigo. That's the first one. Second, it will be penetrated into the under skin surface, into the tissue. So what happened? Under the tissue, you will see something like this happens. What this looks like a bee house. This is called cellulitis. Then the third stage, going to strep throat. So I told a lot of people, if you don't want to come, you don't want to come. You don't make up that story. If you have a strep throat, this is, are you having impetigo, are you having cellulitis, and you go strep throat, and the doctor can do a very easy, quick test. Just put in your nasopharyngeal. Those rapid testing can do in 5 seconds or 30 seconds. And not only that, what will happen? Look at the slides here. There are two other important things will happen. We call it sequela. Rheumatic fever, the first one. What is rheumatic fever? Fever and joint pain. That's really harmful, I tell you. You have a joint pain and you have a fever. Glomerular nephritis. What is this? This is kidney disease. This is kidney filtration problem. What this means? In your urine sample, you could have blood, you could have glucose and protein. All these two symptoms, glomerular nephritis and rheumatic fever, is after even you recover with strep throat. We call it sequela. Post symptoms, it's often severe. So I just want to let you know, Streptococcus pyogenes is really a big deal. I'm not like blame, you said you lied to me, but most of the time what you have is maybe just a virus. Because if you have this, the doctor usually gives you antibiotics immediately. But most of the time the Strep's route, what happened in the real life is it's multi-drug resistant. It's gonna be, you're probably gonna lie in bed for a couple weeks. This is gonna be a severe symptom. So that's really, really bad. So just want to let you know, Streptococcus pyogenes, it's a severe one. It's not really have fun. No fun have to, or you make jokes about yourself. That's really bad. It's very invasive. And you look at here, if you go back to see, they have what type of thing? Enzymes can break the host molecules. They have strep kinesis, dissolve the clots. They have streptolysin ONS, killing host leukocytes. What this means, killing host white blood cell. And the capsule M protein for attachment. Now based on M protein, we can group them into group A streptococcus. So that's a pretty invasive one. Okay, that's group A. What is group B? Streptococcus agalactiae. That's called the GBS. This pathogen, remember, we talk about this. 0 to 2 months, newborn will has meningitis. So, what we have to do? If newborn has meningitis, then the pregnant woman, the mom, certainly will have something happen there. So what we should do? Usually you go to see a doctor during the later pregnancy, 35 to 37 weeks. They have to do is a screening test for GBS. If it's positive, you have to use antibiotics immediately. Because if positive, the newborn will has meningitis, otitis, ammonia, and also bacteremia. So just want to let you know the GBS risk is there. Later pregnancy, do the screening test is important. Lots of people don't want to do it, but it is important because otherwise newborn will be carried on to have those neonatal disease. Okay, so it is important to do the screening test. Same thing. We say this is beta hemolytic. Both of these two. That's GAS. And this is GBS. So on the blood agar, they all showing you transparent zone. It seems like confusing, so what we do? This time, we add a disc. A disc, the components called the basic tracing. Basic tracing is not a very strong antibiotics. It is basically inhibit bacterial growth because they'll prevent the precursor material transferring into the cell membrane, cell wall system to let the bacteria using to building cell wall. So basic tracing is not as strong as penicillin, but it's very good. It's a component of the A disc. So what happened? If you grow Streptococcus agalactiae, which is you grow GBS, it is resistant. I write order. If you grow GAS, which is Streptococcus pyogenes, it is transparent. So what this tells you? That's susceptible. So if at the end of the day you determine it's either Streptococcus pyogenes or Streptococcus agalactiae, then on the blood agar, adding a disc containing bacitracin, you just see which side is turbidity. If you see the colony is growing surrounded a disc, which means it's resistant, that's GBS. If you see the colony surrounded the A is very minimal or there's no colony, it's possibly it's GAS. So that's called A disc. So we could do a very easy conclusion here. This is in your mind system. You have to remember this. Very easy in your mind. You should know here how we differentiate that. We have an alpha hemolytic, and we have a beta hemolytic. An alpha hemolytic, we have Streptococcus, pneumonia, we have a Viridium Streptococcus. Here you have Streptococcus pyogenes, and you have Streptococcus agalactiae. So how you differentiate that? This is P disc. This is A disc. That's optichan, and this is the basic tracing. That's the way you differentiate that in this clinical area. Okay. So we talk about GAS, GBS. There is one thing we haven't talked about. Is GDS, group D. Enterococcus facilis. This is a pathogen, we call it Enterococcus. Long time ago, Enterococcus belonging to Streptococcus, then they separate. This pathogen is very easy to do the determination. The reason is, it is resistant to 6.5% bile salts. Because of that, we have another agar, bile esculin agar comes out. Same as we mentioned about mannitol salt agar. It has the bile salts and the esculin. This pathogen can grow there because it's resistant to 6.5% bile salts. How about the esculin? This pathogen called reduced esculin become esculating. It's showing you black colony. This guy, if you want to do, we can do about that. If I remember, it should be here, here, then this is O, H, this is O. Z is esculin. Now, why this is, we call it a reduce become esculating. What means reducing? Reducing, basically, we are adding this guy, proton there. So we added here. Once we added this esculin become esculating, then it showed the black colony. So on the bile esculin agar, if you see a black colony, it's very typical. It is Enterococcus facilis, and it's a differentiated media. But this color is also very easy to be faded. If you put in the refrigerator for a couple of days, this black color will be faded because this guy could go. Then re-oxidized once it's exposed to the oxygen. So it's very interesting. What we learned in your exam 1, we can certainly apply it here. Now, Enterococcus facilis, there is a two function. Number one, there's a two purpose. Number one, it's a pathogen. It will cause mild infant diarrhea and urinary tract infection, same as Klebsiella pneumoniae. But more importantly, Enterococcus facilis, this is a surrogate bacteria for Salmonella. And we did a lot of research in the lab. Some of the places we cannot use Salmonella as a pathogenic bacteria to do the validation study. And when we could use Enterococcus facilis, because people already verify, if we do the heat treatment, Enterococcus facilis is more resistant compared to Salmonella. So it is a very good surrogate bacteria. Okay? So something else I want to share with you. That's Enterococcus facilis is important. That's called group D Streptococcus because originally it is Streptococcus. Okay, let's talk about Staphylococcus. So something special and something interesting we could talk about that. If we have time, we're going to do the conclusion table, or maybe do the conclusion table on Thursday. So we talk about the Streptococcus, then we have a Staphylococcus. And we know this in our first lab. We're using microscope to do the observation. So what is Staphylococcus? This is gram-positive coccell and grape shape. Looks like that. Looks like a grape. Now, what we're going to talk about is Staphylococcus. We want to talk about three pathogens. Staphylococcus epidermis. Staphylococcus saprophyticus and Staphylococcus aureus. Those are the three things we want to talk about. First of all, Staphylococcus epidermis. We usually say this is a normal bacteria on surface, or we say skin surface. We call it epidermis. What this means, epidermis is on the surface. So that's a normal bacteria. Staphylococcus saprophyticus, the nickname is honeymoon bacteria. What this means, this is a woman at 25, 27-year-old, sexual activity will have sexual transmitted disease. And the typical symptoms is urinary tract infection with abdominal pain. That's a honeymoon bacteria, Staphylococcus saprophyticus. And Staphylococcus aureus, we have three small things to do. Staphylococcus saprophyticus is very easy to determine because among these staph, this is resistant to lower dose novobalsine. It's antibiotics. And all the others are not. So this showed that. So what happened is, if you want to tell a joke, These stories these days when we talk, I have to be careful. A long time ago I can talk just randomly. So let's say there is a 25 years old lady stay with her mom. And one day she said, "Mom, I'm not feeling very well. I had a frequency of urinary, and I have abdominal pain, maybe with abnormal period." Then the mom took her to see the family doctor, and the nurse did a quick test. And she told the mom very privately, said, "We did a quick test for the lower dose novel bowsing, and your daughter have a honeymoon bacteria." And the mom will be thinking about maybe a couple of nights ago has not come back, maybe with some boys. So that will happen. Now, why it's easy to do the determination? Because this is very special. You're using novel bowsing, rapid testing, you can test it immediately. So that's Staphylococcus saprophyticus, and the nickname called the honeymoon bacteria. It's one of the pathogens cause sexually transmitted disease, but the age group is usually 25, 27-year-old sexual activity girl. It's not as severe as syphilis. Staphylococcus aureus. This we want to talk about 3 things. Number 1, we want to talk about food intoxication. This happens very often for chicken salads. So how people make chicken salads? You have a chicken, shredded, you have a salad, and then you mix them up. Then in the winter season, what happens? Like this, like sneezing, then they make it. And Staphylococcus aureus, we already said, it's called on the skin surface. If you are doing sneezing, it's very easy. If you don't wear gloves, it's also more happen. Even you wear gloves, still could be happen. So chicken salads is $3 or $5 with coupon. It's very high risk for Staphylococcus aureus. Some people eat it, 6 hours will have a diarrhea, vomiting, and abdominal pain, and nausea. This is food intoxication. And be careful, this is exotoxin. So what this means, even you heat it, it may spill it, because it's heat-resistant toxin. It's not endotoxin. Endotoxin is it's heat liable. So that's food intoxication. This is the first thing I want to mention. Second thing I want to mention is MRSA. This is lots of people heard about it. Staphylococcus aureus have a very special strain called methicillin-resistant Staphylococcus aureus. So, called mushroom. So what happened is, during the development of antibiotics, people use penicillin, people use amoxicillin. Then they find that it started to get resistant, antibiotic resistant very easily. So about 20 years ago, they developed an advanced level of penicillin. It's called methicillin. And the methicillin, what they can do is oral administration, resistant to the acid environments. It is a little bit heat resistant. It is also changed the structure, so it is less antibiotic resistant by the time. However, because using too much, and also because of the failed sanitation standard operation procedure in some of the hospitals, including the post-surgery rooms, so they become more severe contamination. We call it a methicillin-resistant Staphylococcus aureus. You heard about this all the time. It's become universal, a very common habit, a typical resistant, antibiotic-resistant pathogen. And this one, we call it nosocomial infection, which means this is hospital-acquired infection. And the only reason cause this is carelessness. People think this is a magic tool, however, it's failed all the time. Then it become more and more antibiotic resistant. So we call it some MRSA. Number 3, TSST1. Toxic shock syndrome. The story comes out with this terrible tampon. So back in 1970s, there's a brand of the tampon called Riley. So what happened is the people like the tampons to be highly absorbed with liquid. So you should know in the vagina area, we have a lot of the bacterial community, which is a beneficial bacteria. Like, let's say lactic acid bacteria is there. And we need some of the moisture to let the bacteria grow. And if you are using a highly absorbent tampon, what happens? The moisture is gone. Once the moisture is gone, those beneficial bacteria are dead. And Staphylococcus aureus could be dominant there. Once they dominate there, they could release the toxin. And if the toxin into the blood cell, what happened? You're going to have a hypertension, which means the blood pressure will be decreased. And then you do not have enough blood go to the tissue, go to the organ, will cause a decay. Or we say it's like a toxic shock syndrome. Basically, you have a coma. And it causes people to die. And if you go to search the Google, the Riley tampon in 1970s has killed about 23 women in the Texas area. So this product has been out of the markets a long time ago. But this is the first time people are going to recognize Staphylococcus aureus is a major risk for that. So if you remember this horrible tampon, then you're going to be remember the toxic shock syndrome, which is coming from Staphylococcus aureus. And this is also the Staphylococcus aureus. We talk about the impetigo and the toxic shock syndrome about that. Now, why Staphylococcus aureus is very invasive? You look at this table, you will know. So this table tells you the enzymes and the toxins created by Staphylococcus. The first column is a product. The right side is each corresponding to the physiological action. You're going to look at how many enzymes there. You have lactamase, catalase, coagulase, DNase to destroy DNA, enterotoxin. You have an exofolia toxin, hemolysin, lipase, nuclease, protein, protease, a toxic shock syndrome, toxin 1. Basically, everything you have, it will has it. That's why it could break down the tissue, the organ, and all the material there, and cause a very invasive impacts. And that is the reason for that. For those 3 passages, we could have a very easy determination for that. We can have a table to talk about that. I'll talk about briefly. So what happened? We talk about beta hemolytic. If you have Staphylococcus aureus, it is beta hemolytic. And the other 2, these are gamma hemolytic, which is nothing will happen. That's one thing we could determine. The second thing we could determine, we just mentioned, low dose novovalcine, Staphylococcus aureus is resistant. The others are susceptible. Another thing I also want to say, you maybe still remember mannitol salt agar. If we are using mannitol salt agar, we are looking for 2 things. One thing is resistant to salt, another one is differentiate mannitol fermentation. Of course, there's Staphylococcus in our organic growth, but what's the difference is fermentation. You will see Staphylococcus aureus is mannitol fermentation positive. What means that? That's yellow colony. And the other two, it is actually original pink color, so it is colorless. That means medical fermentation negative. Another very special thing for Staphylococcus aureus, it is coagulase test positive. So what is coagulase? It will cause blood cell clotting, abnormal clotting. So we can do a research of simple test. We add rabbit saline, blood saline. If you are going to add in Staphylococcus aureus go there, you stay in the room temperature about 2 hours. You flip this tube. This is glued. Very interesting. It is glued. And you add Staphylococcus saprophyticus and epidermis, nothing will happen. What this tells you is certainly you can understand it can be due to gluing of the blood sample. That's called coagulase. Let's say coagulate together. That's another typical testing for Staphylococcus aureus. Regarding this, we could do a table to do the conclusion. And we also could be using a very simple way to differentiate the Staphylococcus aureus and Streptococcus. This we will talk at the beginning of Thursday. And following that, we'll move into a big topic, it is Clostridium. And then we can end up this major section of about the bacterial caused disease. Okay? So that's all I have today.